Well, good evening, everyone. As you can see, it's Halloween by the decorations in the waiting room of the surgery, and I'd just like to start off. It's the beginning of winter, if you like. We're going into the colder weather now, and to discuss with you a little bit the relevance of that. As you probably all know, in the winter months we're all that bit more prone to coughs, colds and flu, and interestingly enough, dental problems tend to arise in a corresponding manner, and people that have had low-grade infections, possibly a dormant abscess on a tooth or on a wisdom tooth, will suddenly start to find these infections coming to the forefront. So don't be afraid to let your dentist know if any of those things happen. And you'll also find there's an increase of things like mouth ulcers. What can you do about it? Well, in a general sense, just a little bit of a guide to you. Vitamin C is wonderful. None of us store it in our bodies. It's a water-soluble vitamin, and we need it every day. And in the winter it tends to get a little bit depleted because not all of us have our fruit diets. So if you want to take anything, take some vitamin C. And what it does, it increases what we call cell binding. So the cells in your mouth, your throat, your lungs are just held that little bit more together to stop bacteria getting in. Mouth ulcers are a perennial problem at this time of the year, and as you know, everybody tends to get one. What do you do about it? Well, one of the simplest things is a bicarbonate of soda mouthwash. Get a teaspoonful of bicarbonate of soda, put it in half a glass of lukewarm water, and irrigate the area just gently 2 or 3 times a day. It tends to then take the swelling out of the ulcer and it heals naturally. If the ulcer persists beyond the 7 to 10 days they normally do, then please contact your dentist so that you can have a look in your mouth to see if there is a rough area or something irritating the tongue or cheeks, and that needs looking at. And finally, dental sensitivity. In other words, when we have a cold drink or breathe in cold air, yes, it's a bit more prevalent this time of the year because the water starts to get colder in our taps and we go from centrally heated buildings into the cold. Years ago, everybody would have all the necks of their teeth filled. Today, that doesn't tend to happen so much because these areas at the neck of your tooth are quite natural. Everybody will get a little bit of root exposed in their time. Obviously, as you get older, it gets slightly worse. Most of these roots, if they're cleaned properly, do not decay, and they undergo what's called sclerosing, which means that in fact they seal themselves off. And if that doesn't happen, then there are lots of desensitising toothpastes on the market. And just a little clue on using them, best time to use them is last thing at night. Clean at night well with them, and then don't rinse too much because then the effect of them lasts all through the night while you're asleep, and you'll get the maximum desensitising from those toothpastes. I hope these little clues have helped take you into winter after my advice in the summer, and that hopefully we all have a very trouble-free winter together. Thank you very much. Goodbye.